Oh, yeah.
What is up, everyone? Welcome back to Kanika RN. This is the third video in my NCLEX series. And in this video, we're going to focus on how exactly to analyze and answer NCLEX style questions. So the first two videos in my series, I'm going to link them down below. The first one, I talk about my NCLEX taking experience. I passed in 76 questions, not 75, but my goal is through this series of 5 videos for you to beat me and actually get the 75. And if not the 75, then as few questions as possible. And the second video, I talk about a specific study plan. I give you a very, very specific study plan on how many questions to do per day, how many days before the NCLEX you need to be studying. I give you all that information. I also give you a link to a free practice test. So both of those first two NCLEX videos are going to be linked down below, so go ahead and check them out. So let's hop right into today's video. The NCLEX is a very, very tricky test, I think, because it not only assesses whether you know the right answer, it's trying to gauge whether you know the most right answer. So there are times when you'll have 4 answer choices and each one of them will be correct, but you have to figure out which is the most important and which answers the question most completely. So the way that I think NCLEX gauges things is cool because it does very much apply to actual nursing practice. This is what I think nursing is. Nursing is you have to do usually 4 or 5 things at once. Sometimes it feels like about 2,700 things at once, but you're trying to constantly juggle, okay, I have these 5 things to do. Which is the most important? Which is going to contribute to my patient's safety and well-being? So you have this constant like shuffleboard, and it's constantly reorganizing of like, okay, this patient's not breathing, I need to prioritize this first. This patient has a heparin drip, I need to draw PTT to assess whether I need to go up or down on that drip. This patient's pressed their call light, but all they're asking for is a glass of water. So this board in your brain is constantly kind of reorganizing and reshuffling. So that's the way I think it's really good to approach the NCLEX, is if you have these 4 options, which is the highest priority, which is the most correct, and if you approach it that way, I think it's going to contribute to your success. So my first tip is a very, very simple one, and that is to read each question twice. I am someone, when I'm reading something for the first time, my brain will automatically want to skip through and try to gauge the most important pieces, which it is good to identify keywords, but it's very important the first time you read the question, really try to gauge the entirety of the question, read the whole thing completely, and then go through it one more time just to make sure you're not misunderstanding anything, you haven't missed some important piece of information. So make sure you read each question twice, especially when you practice these NCLEX questions. I think that'll contribute to you reading things more carefully when you're actually taking the test. So as you're reading the question, there's 2 things that you should be kind of going through in your mind. Number 1 is all this information that I'm reading, what's normal in this statement and what's abnormal in this statement. And if there is something abnormal, which there's going to be because that's what this test is trying to gauge, is your response to abnormal things that you will see in your patients, what do I need to do about it? And what's most important for me to do? So always remember, the old recommendation for the American Heart Association used to be airway, breathing, circulation. The newer recommendation is circulation, airway, breathing. So anytime there is a priority question, which you will have a lot of those, you have these 4 patients, these 4 issues, and they all need to be addressed. It's important for you to address all of them, but which is most important? Anytime you see a patient's circulation is compromised, their blood pressure is very low, they're having trouble breathing, they are not able to clear their airway. Anytime you see that in an answer and the question is a priority question, your brain should automatically be ding, 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 ding. So the way the NCLEX is going to try to trick you is play on your emotions. So some of the answer choices may say, you have a patient who's pressed the call light twice, they're irritated, they want to see the nurse, and then you have these other 3 patients that need to be seen. Don't add any information. Don't assume that this patient who is pressing the call bell is pressing the call bell because of some urgent physical need. If the question or the answer states that they are having difficulty breathing or anything like that, then that's okay for you to prioritize that. But anytime you have patient is annoyed, patient is irritated, patient, a family member is trying to talk to you, but you have another answer choice, another patient whose airway, circulation, or breathing is compromised, you will always prioritize them first. So make sure you keep that in mind. Another very important thing to keep in mind when you're answering these questions is number one is assessment, then intervention, then evaluation. So if there's a question with a patient who has some compromise of lab values, any physical response is abnormal, the first thing you want to do is, do I need to make any further assessment right now before I act? Usually if it's a life-threatening situation, your priority is going to be action. You may not even have time to assess anything further. But if you have some information and you feel like some piece is missing, some piece of assessment is missing before you carry out your intervention, then make sure you do that piece of assessment. Also, a lot of times questions will ask you, do you need to notify the doctor? That will be a common answer choice, but you want to be very careful about this one. Most of the time, I'm not discouraging you from choosing this answer choice, but be very, very careful about choosing this answer choice. Usually there will be some sort of assessment or intervention that you need to do before you select the answer choice calling the doctor. You can always also assume that most of your orders will already be in place for things that you need to carry out. So just be very, very certain that there is no further assessment or intervention that you need to do prior to notifying the doctor. Here's an example of another kind of question you might deal with the NCLEX that might trick you into thinking that you need to do one thing or answer in one way, but you actually need to answer in another way. So anytime there is a question that says, which of these statements requires you to clarify your education? Which of these statements suggests that your patient did not understand your education? So basically what it's saying, which of these statements are incorrect? If you need to clarify education, if you need to clarify a statement made by a patient or made by a family member, that means that they have said something incorrect. So in your 4 answer choices, you're looking for the incorrect answer, which is kind of a mind trip. And NCLEX likes to play these little games with us, but just keep in mind, if there's ever a question that states, which of these statements requires you to clarify, which of these statements requires further education, in your brain you should be thinking, okay, one of these statements is wrong, which me as the nurse requires me to clarify or to correct that information. So make sure you keep your eye out for those kinds of questions. So the part of the NCLEX that I personally found the easiest, or I don't want to call them gimme questions, but I just feel like they required the least amount of memorization. Some people actually struggle with those questions the most. And those are the psychosocial questions, or the questions where it's a patient has made a statement concerning something non-physical. So a great example, and probably you will face this several times on your test, is a patient is saying something like, I feel so hopeless, I don't know what to do anymore. Or a patient states, I have a plan for harming myself, what is your intervention? Or a patient says something like, I feel like my family is taking things too personally, I don't want to carry on with this treatment. Our instincts as a human, and probably a nurse in the situation, we may not act in the way that the NCLEX wants us to answer. So our natural instinct will probably be to reassure the patient, to say it's going to be okay, or we might draw on personal experience saying, I know exactly how you feel. My brother-in-law went through the same thing. My dad went through the same thing. But in NCLEX world, this is wrong. They don't want you to do this. In NCLEX world, most of the time, the appropriate answer to this kind of question is simply to get the patient to talk more. So an example would be a patient that says, I just don't see the point of carrying on anymore. I don't want to continue my treatment. Answer choices may include, I don't want to hear talk like that. You have to keep fighting. You're doing so much better. Another answer choice might be, my sister went through the same thing. I completely understand what you're going through. And another answer choice might be, what is it about your situation that's making you feel this way? Tell me more about what you're experiencing. Tell me more about your pain. 99% of the time, the tell me more, explain to me more is going to be the correct answer. Because your position as a nurse, specifically in NCLEX world, what they want you to do is just be a sounding board for your patient. They want you to fully gauge what the patient is feeling without advocating for any specific course of action on what the patient needs to do. Absolutely avoid any judgment statements in terms of, you're doing much better, don't talk like this, I don't know why you feel like this, or anything of, like I said, drawing on any prior experience, this went through this person went through this, and this was the outcome. In NCLEX world, these are a big big X. So any answer where it's just going to make the patient talk to you more, elaborate more, explain more, that is the answer choice that you should be looking for. One of the biggest mistakes that gets made when people are taking the NCLEX is adding extra information or making inferences about things. So you want to make sure that you don't look at any information, whether that's the questions or the answers, and add, oh, this must mean that this patient is going through XYZ, blah, blah, blah. Don't add any information on. Just take whatever information you have in the question and in the answer choices and base solely on that. Of course, you will have some nursing diagnoses, some disease processes, some drugs that you will need to memorize, and they will assume that you know the information in order to answer the question correctly. But in terms of feelings, in terms of adding extra information, inferring what the patient is going to do after or before, or they're doing this because they're in pain, or that kind of thing, I wouldn't necessarily infer any of that. Try to take whatever information you have at face value, and you have to kind of approach the NCLEX like a game a little bit, I think. You answer questions in the way that you think you're supposed to answer them, especially when it comes to the psychosocial questions, rather than what you would necessarily do in that scenario, if that makes sense. So because we've gone through all this information, I don't want to make this video too heavy or too long. What we're going to be doing next week is applying all these concepts and doing a few practice questions so I can really explain and break down how these concepts will apply as you're taking the test. So if you have not already, please go ahead and subscribe, hit that little bell icon beside it so you don't miss any more videos in this NCLEX series or any of my other videos. If you enjoyed this video, if it was helpful for you at all, please go ahead and give me a big thumbs up. Comment below anything else I can do for you on this channel, and if you found this video helpful, tell me where you are in your nursing journey, if there's anything else I can do for you. And like I said, next week we're going to break this down more specifically and show you how these concepts can be applied as you're taking the test. And as always, my friends, keep it sweet and salty, and I will see you guys next week.